Clinical examination of the central nervous system. Cranial nerves 3, 4, and 6. The third cranial nerve is the oculomotor nerve, and it supplies the superior rectus, medial rectus, inferior rectus, and inferior oblique muscles of the eye. The fourth cranial nerve is the trochlea, and it supplies the superior oblique muscle. And the sixth cranial nerve is the abducent, and it supplies the lateral rectus muscle. So let's use this acronym to remember: LR6 to bracket SO43. So LR6 is lateral rectus cranial nerve 6, and into bracket SO4 bracket close, that's superior oblique cranial nerve 4, and the 3, as all other muscles of eye movement, are supplied by cranial nerve 3. Okay, so a quick recap of the extraocular muscles, as the muscles around the eye. So the right eye, as the lateral side of the right eye, you have the lateral rectus, and the medial side of the eye is the medial rectus muscle, and the upper lateral part of the eye is the superior rectus, and the lower lateral part of the eye is the inferior rectus muscle. And when you come to the middle part of the eye, the upper medial part of the eye, you have the inferior oblique muscle there, and also the medial lower part of the eye, you have superior oblique. So it's more like the reverse. The superior oblique muscle of the eyes are the medial lower part of the eye. Okay, so those are the muscles of the eye. So the nerves individually and collectively are responsible for three things: pupillary response, eye movements, and elevation of the upper eyelid. So under pupillary response and eye movement and elevation of the upper eyelid, you're not only testing for a lesion of these cranial nerves, but you may also be testing for a defect of sympathetic or parasympathetic nervous system. And eye movements, you may elicit nystagmus. Nystagmus is basically the rhythmic movement of the eyeball, and it may be horizontal, vertical, or rotatory. And you may also elicit a disorder of conjugate eye movements, or failure of the eyes to deviate together so that both eyes are fixed on the same object. So this indicates a disturbance in the cerebellum, or the pathway of the cerebral hemispheres.